Good day, everyone. I'm Dr. Yang Shen. I'm from Eye and ENT Hospital, Fudan University, Shanghai, China. Today, we will introduce how to perform a standard small incision lenticule extraction smile surgery. Before the surgery, the patient's ocular surface and conjunctival sac should be rinsed by a nurse under topical anesthesia, and the skin at the periocular area should be disinfected. The patient lies supine on the surgical bed, and topical anesthesia is administered again to the ocular surface. A steroid drip is placed, and a suction cone is installed. An eyelid speculum is used, and a moist steroid sponge is used to wipe the cornea, which removes any potential lipids or secretions. The patient is instructed to fix it on an indicator light in the center of the suction cone. The surgeon needs to operate the joystick to align the center of the cornea with the center of the suction cone. Then, the surgeon needs to twist the joystick to elevate the surgical bed until the cornea comes into contact with the suction cone. At this point, a circular watermark forms. Continue to slowly elevate the surgical bed until the watermark occupies 85% to 90% of the suction cone. At the same time, it is essential to maintain the boundary of the watermark as a concentric circle with the boundary of the suction cone. Then press the suction button. Once it is confirmed that there are no lipids or bubbles within the watermark, you can press down on your foot pedal to initiate the laser scanning. During laser scanning, the patient must be constantly guided to maintain fixation without moving their eyes or blinking. Once laser scanning is completed, lower the surgical bed and move the patient under the surgical microscope. A semi-moist sponge should be used to remove any tears and lipids in the conjunctival sac. A toothed forceps is used to clamp the conjunctiva at the limbs. The tip of the separator is inserted into the incision while gently lifting up to enter the space between the upper surface of the lenticule and the cornea cap. When separating the upper surface, the separator should not be pressed down and ensure the tip does not exceed the laser scan area, and the tail of the separator should not be disturbed excessively to avoid tearing the incision. When separating the lower surface, the tip should be gently pressed down to enter the gap between the lower surface and the corneal stromal bed, and the tip should be kept slightly pressed down all the way to avoid scratching the lenticule. Simultaneously, it is essential to protect the incision from tearing caused by the tear of the separator. The head of the lenticule forceps needs to fully enter the incision to grasp the lenticule. Attention should be paid to ensuring that the edge of the lenticule is intact. This is a standard smile procedure. In the future, we will progressively elaborate on the key points, precautions, potential complications, and the management of complications for each step of the smile surgery. See you next time.